In Canada, we assume that freedom of conscience and religion are rights granted to all people in our country. But these rights are becoming less clear when it comes to assisted suicide and the protection of conscience rights for medical professionals. Now, one of our guests today is David Anderson. He's the MP for the Saskatchewan riding of Cypress Hills Grasslands and the Shadow Cabinet Secretary for International Human Rights and Religious Freedom. And he joins me today from Ottawa. Welcome to BCN, David.
Thank you very much. I'm happy to be here.
Now, when assisted suicide was legalized back in 2016, Canada went from seeing this as a form of homicide to now being a taxpayer-funded human right. Things changed pretty quickly.
Yeah, the Supreme Court, when it's made its Carter decision, did not declare that we had to have euthanasia in this country or that physicians had to participate in it. But certainly the legislation that the Liberals have passed have set that up. So we now do have an assisted suicide / euthanasia regime in Canada. And people are working to expand it, while others of us are trying to work to protect the conscience rights that many people feel should play part in this discussion.
Now, you tabled Private Members Bill C-418, the Protection of Freedom of Conscience Act, in the fall of 2018. Tell us what this bill is really designed to do.
Well, C-418 is a response to C-14, which was the government's assisted suicide legislation. And within that, the government bill, they had included a clause that no one could be forced to participate in euthanasia-assisted suicide if they did not choose to. But they did not define the offense. They did not put any kind of framework around it. So C-418 basically brings that framework into play. It makes it an offense for anyone to intimidate, coerce, or threaten someone into participating if they don't want to. It also makes it an offense to change or threaten to change someone's employment status if they won't participate. And it talks about any person doing that. We believe that definition of person should include persons, employment, institutions, the institutions themselves, and the governing regulatory bodies for the various medical societies.
Now, you believe the right to refuse participation based on conscience is a constitutional right. Did the Supreme Court decision specifically say that physicians would not be required to participate?
They did not say that. They did not rule on this. Well, when they ruled on the Carter decision, they did not require euthanasia to be a kind of a requirement within Canada. That was not part of that. The government themselves have made the decision that this is going to be part of their social policy and social process, and they're the ones who brought the legislation forward that brought this into play. So the courts were not the ones who forced the government to bring forward the legislation that we now have.
I understand that in Ontario, physicians are now required to provide an effective referral for medical assistance in dying. The argument seems to be that this should curtail any concerns you may have because you're not directly participating. How would you respond to that?
Yeah, this is very controversial because the provinces each set the standards. And so various provinces across the country actually have different requirements of physicians and of medical personnel. Ontario is one of the most restrictive in terms of requiring physicians to refer. That hopefully will change here in the future. Alberta has a much more balanced approach to it, which is to basically you're required to notify people of the options that they have and where they can go to find the information, but you're not required to actually send them there. And so there are, some people who think that even goes too far. I should be able to just refer to an institution or whatever, not have to participate in the process. But certainly Ontario is the most restrictive and most demanding. And I think there are many physicians now are getting very uncomfortable with those requirements.
So what do you say to critics who argue that this bill would limit or prevent some Canadians from being able to access medically assisted suicide, like medical assistance in dying?
Sure, it's a good question, but this bill actually doesn't touch on that. It just basically says that employers, for example, cannot threaten their employees who do not want to participate, and it makes no offense for anyone to coerce or threaten or intimidate someone into doing this. But we're certainly seeing, unfortunately now, even hospitals are posting the assisted suicide MAID information. They call it medical assistance in dying is their term for it. We just prefer to use it euthanasia or assisted suicide, but they're posting the material on the walls now, making it more available to people. So I don't think that there's a shortage of opportunity if people want to participate here, but we do want to protect the rights of those who don't want to be part of this, especially those who believe that we should see life through to its natural end.
Now, some believe there's a need to have a publicly available list of willing doctors or perhaps have medical assistants and dying specialists who travel the country. What are your thoughts on that?
There's a number of different ways that people can get access to the information that they need if they want to participate. We think that there's, the referral system is one of those. That's not one that we would prefer. Providing a directory of some sort might be another way. We have telehealth numbers across Canada which people can use. So there's no reason to be coercive about this. There's enough opportunity and options for people that we can make those provisions for people who don't want to participate to be able to step aside. And this doesn't just affect physicians, it affects nurses as well. And I've had a couple of them call me very concerned about the fact that the people in their nursing homes are now being subjected to this, and they don't want to have any part in that. So we need to protect those people, I think.
Are you aware of any cases where a medical professional has been fired for refusing to participate in assisted suicide?
Okay, I've not heard of cases where people have been fired. Typically, physicians don't get fired, but I have heard of physicians who are shutting down their practices, particularly around palliative care, in order to avoid the issues that are found around this issue. So in a country like Canada right now, where we have a shortage of physicians, it's very difficult to get physicians. I don't think we should be setting up a structure that actually chases them away from the job that they love, and especially for those who are in palliative care, who are making a commitment to people coming to the end of life. I just heard my colleague this afternoon, Mark Warawa, who is retiring but is going, has a fight for his health going on today, make a plea for more palliative care physicians in Canada, because he said this is what we need for people who find themselves in a palliative situation. We need to be able to care for them, not just tell them it's time that you took part in assisted suicide or euthanasia situation.
So David, if this bill was to pass, would it also provide protection for faith-based institutions such as Catholic hospitals or nursing homes where patients might request medical assistance in dying or MAID?
Okay, well, the scope of this bill is limited, and we did that deliberately, trying to be able to get the focus narrow enough that we could try to get it passed. So it talks more specifically about medical personnel than it does about the medical institutions. I would certainly like to see this issue of conscience protection be much broader across our society. I think we have the capacity in Canada to be able to allow people to hold different positions. And as these issues become more important, I think we're kind of more of a priority or have a higher profile, we need to be able to make accommodations for people. And I think we've got the capacity to do that. We've got the maturity to do that. We need to have a discussion about it, and I'd love to be part of that discussion.
Tell me about your relationship with Alex Schadenberg with Euthanasia Prevention Coalition. Do you guys ever team up?
Well, yes, we do. I've been part of the pro-life caucus on Parliament Hill since I came down here, so that's 19 years ago. It's been a long period of time. We've had a great relationship with a number of the pro-life organizations, and Alex has done phenomenal work. We've been able to partner with him on different issues. Certainly he's supportive of C418. He's been a good partner in putting it together and then trying to move this issue forward. He's been one of those stalwarts on this discussion around euthanasia prevention, assisted suicide, and palliative care that has played a very important role in Ottawa here over the last few years.
Now, there are groups in Canada who've been advocating our government to allow minors to receive medical assistance in dying. That was a big concern for Alex Schadenberg as well. Do you think there's a real possibility we may see this happening in our country?
Well, one of the concerns is our President Attorney General is one of the people who actually did not support his own government's legislation because he felt it didn't go far enough. And it was interesting that as soon as the first stage was passed, then we begin to hear advocates saying we need to go much further. And minors is one of the areas that they want to go uninformed, basically uninformed or prior consent. I guess you could call it prior consent, where someone then finds themselves in a situation where they can't consent. Is another suggestion from some of these groups that they want to be able to perform euthanasia at that point as well. So we believe we've gone too far already, but certainly we don't want to see those boundaries move any further, and particularly in the area of minors or the disabled and handicapped people in our society.
You know, one of the points that I remember Alex brought up with me in the past is that it really is a slippery slope when you involve minors. You know, parents could say, my child is suffering from terrible depression, there's no way out of it, this might be the only option. I mean, that's a dangerous precedent. That's a dangerous road to go down.
Yeah, well, mental health issues, as you point out, is a whole nother field of, where people are beginning to advocate for the options, and sometimes people are not thinking clearly. There's other factors in the background. I've talked to some physicians who've talked about underlying causes of why someone might want to participate, and then when you sit down and talk with them, you find out there are things like elder abuse taking place, or there are people who are neglecting their parents, or there's reasons why families are trying to push someone in that direction. So this is something that is what we thought it was, which is that people will be coerced and forced into it, and we need to make sure that we protect people at every point.
Now, you've served as an MP for almost 20 years, and you're not going to run again in the upcoming federal election. First of all, let me ask you, does it feel like 20 years?
It feels like a lifetime, but it's been a great opportunity to be here. I have mixed emotions about leaving because when you really like doing a job, you have mixed emotions when you leave it, but it is the right time for us to do that. I've had a good run, and I've been happy with the results and the things that we've been able to do here. I've been able to work with some great people. I've had good staff forever, and that has made a huge difference for us. And my wife Sheila has been patient with me over the years, but it really is time that I spent some time with her.
But I'm kind of guessing that your bill C-418 is unlikely to pass before then. Will somebody else be picking up the baton?
Well, I've had a commitment from a few of my colleagues that they will pick it up next Parliament when it comes back, and I think we'll be in government. So hopefully, it could be a part of our government policy because our party has been very supportive of this principle. So certainly, we'll see where it goes. It's unlikely, with the amount of time that we've got left, that this bill will pass. We're going to have a debate on the House, I think, on May 29th. If the schedule stays the same as it is now, that would be the first hour, and then there will probably be a second hour in June. We may not even get to a vote on it before the House rises for the summer.
Provincial health care budgets are all under huge pressure with rising costs. Now, are you hearing of any cases where patients are being pressured to choose medically assisted death rather than choose the more expensive medication or palliative care?
So I haven't heard of any of those examples yet, but I think we are all anticipating that that will be the case in the future. As this goes a little bit further ahead and becomes more acceptable, and you start to see the boundaries being pushed back on it, as some people want to do, I think that one of the things you'll see is that, well, there's a good reason here. There's a reason of expenditures of public funds, and perhaps it's that's a good reason for us to be expanding the application of this. I'm concerned when I see the posters on hospital walls that would encourage people to consider this as an option. And I talked to a physician just in the last couple of days, and they pointed out that the Hippocratic Oath actually has a clause in it that says, and it said for good reason from the beginning, but it says that we will not administer poison. And it's just interesting that I would argue that assisted suicide and euthanasia is doing exactly what they've said they will not do.
Any final thoughts on conscience protection rights? What our viewers can do to really make a difference?
Well, we'd like to see people keep this at the top of their minds over the next few months. C-418 may not pass, but we would like to come back to the next Parliament with this as a priority of the government. And I am anticipating that the Conservatives will form government. It's been part of our party policy, but we do need people to remind their MPs, push them, and encourage them to pass legislation such as this. So look forward to it, but we want to keep it in people's minds. If they want to contact their MPs and let them know it's important, that would be a really good idea.
David Anderson, MP for the Saskatchewan riding of Cypress Hills Grasslands and the Shadow Cabinet Secretary for International Human Rights and Religious Freedoms. Thanks for your time today and happy retirement.
Oh, well, thank you. I suspect we'll find something to keep us busy.